through the talk. We only have one talk, so we'll be a little bit, we're not on a big time crunch this morning, but if you have comments or questions, use the chat liberally. We can come back to it, but we'll also have time at the end for conversation. So I will turn it over to Brian. Thanks, everybody.
Well, Stephen, thank you so much for that nice introduction. And Kyle, I just wanted to say again, thank you so much for coordinating this. I really appreciate sort of your work behind the scenes to make sure that these events are happening. And it's a privilege to be here on the last day of the summer, meeting with you today. So, Stephen, as you mentioned, I do have a bit of a checkered past. I worked professionally in industry for a number of years. I worked in the Department of Education, National Center on Performance Incentives for a little while prior to that. And then in my PhD work, focused on online discussion about news and civic issues, applying concepts from public deliberation, online communities, and crowdsourcing to think about how can we bring people together to problem solve some of the challenges that we're facing. Well, during the COVID-19 pandemic, like many researchers, I realized that the area that I had been focusing on for so many years around how do we help people to talk with each other about current events, that area had this underlying health component that I didn't fully understand. Mental health, wellness were underlying many of the challenges that people face when it comes to coming together in an online discussion forum. So in response to that realization, I made this considerable pivot in my research and switched over to public health for a period of time. And most recently, I was part of the School of Public Health at UC San Diego as a postdoc in the Recode Health Center, which focuses on ethical, legal, and social implications associated with digital health technologies. So I had an opportunity to really dive into what is digital health and how do we think about informing the people who contribute their time to science to help advance digital health research. So today, what I'm going to share with you is some of the research that the team that I was part of at UC San Diego advanced over this last year and just got published over this last year as a way of sort of setting the stage of what health researchers, as well as researchers in the School of Information, might think about doing here at UT Austin moving forward. So with that introduction, my talk is exploring the future of informed consent. Informed consent must be organized and presented in a way that does not merely provide lists of isolated facts, but rather facilitates the prospective subject's understanding. This is taken directly from the federal regulations for the common rule, and I think is a really profound, important statement guiding a lot of the research that our group at UC San Diego advanced. In terms of the talk today, I'm going to, here are the major takeaways. Major takeaways from our research. It is particularly important to think about partnering with participants in digital health research. The informed consent process is a key opportunity to cultivate that trust with people. And as we found through our research, and as I'll talk about today, there are clear opportunities to improve informed consent processes by paying attention to the expectations that people have for the consent process, by thinking about the different levels of detail in consent materials that people look for when they volunteer their time, their energy, and their data, and also thinking about creative ways of presenting the technical details associated with the study, such as with data visualizations and other interactive experiences. And then finally, if we're really thinking about the future of informed consent, so much of informed consent is really mediated by computing systems. And because of that, researchers, IRBs, and patient advocates need to weigh new considerations about the design of informed consent. So I'll end the talk by talking about how to incorporate research ethics work into our digital health studies going forward. Informed consent is a cornerstone of ethical human subject research. This practice demonstrates the ethical principle of respect for persons. According to the US Federal Code, also known as the Common Rule, informed consent must be organized and presented in a way that does not merely provide lists of isolated facts, but rather facilitates that prospective subjects understand. Now, before I get too deep into the research that we've conducted, I do want to uh, really do a shout out to the wonderful team that I was part of at UC San Diego, and I still work as an advisor. So it's an honor to present research about the future of informed consent on behalf of my colleagues from the Research Center for Optimal Digital Ethics and Health at the University of California, San Diego. This includes the director of the center, Professor Camille Nebecker, who is just an absolute expert when it comes to thinking about ethics and digital health. The Recode Health Center, you might have heard of in the past to advance the digital health checklist, which is used by thousands of researchers to evaluate their consent materials and their practices when thinking about data privacy and confidentiality considerations of a study. The Recode Health Center also created the CORE Network, which is an international organization of digital health researchers who are actively sharing information about their research studies so that collaboratively we can get a better understanding of what are the challenges of communicating research and engaging with research. The Recode Health Center has also advanced building research integrity and capacity training, which many people have undergone. The research that I'll share was generously supported by a number of funding organizations, including PCORI, NSF, as well as the NIH. So let's dive into the first takeaway from today's talk. It is particularly important to partner with participants in digital health research. Digital health technology can provide personalized and just-in-time health interventions by collecting a large volume of granular data about people and their environments. Sensors worn on the body might be used to track heart rate, geographic position, and physical activity of participants. Sensors embedded within a patient's environment, like smart speakers, can passively collect audio data from the space, which might be used to notify nursing staff if a patient is exhibiting signs of distress, for example. Communication systems such as data dashboards can help to bridge information gaps between clinicians, their patients, and the other people who care about their well-being. The promise of digital health is that providing people with in situ and real-time feedback about their health, these technologies can facilitate people toward decisions that promote their well-being. However, there are ethical questions about how people are made aware of the data that's collected, how that data is managed, and what are those sharing practices. Another consideration is that digital health can involve many people, in fact, whole communities of people. Digital health research may involve investigating existing online communities. For example, patient support forums can be a source of information for people surviving a health condition. For example, the 2 Diabetes Forum provides mutual aid as well as emotional support for people grappling with diabetes. For digital health researchers, an online community can be a source of expertise for participant recruitment and a site for research in itself. However, there are a range of research ethics considerations which play into how research teams gain access to a community, how they notify others within the community of their actual presence, and how they invite people to contribute to research and communicate study results back to community members. Just a quick show of hands, if you wouldn't mind using your reactions at the moment. How many people on the call right now are using artificial intelligence as part of their research? No one. Interesting. Interesting. Well, many researchers in digital health are starting to incorporate artificial intelligence in 2 ways. First, into the technology itself that they're exploring with research participants, and then in the second, in terms of collecting data for the purpose of AI-oriented health research. You might be familiar with the NIH Bridge to AI program, which is a large effort to collect data for the purpose of health-driven AI. Well, there are important ethical considerations associated with the introduction of novel technologies like artificial intelligence into a digital health study. These include the fact that these novel technologies, can be too challenging for people to fully grasp. Uh, the complexity of these technologies raise concerns about whether participants can fully grasp the novel technology enough to even raise a question and feel fully informed about their decision to participate in a research study or not. Pickering et al., 2021, propose a trust-based alternative to informed consent in which people can cultivate trust in the researchers and their intentions for a study, even if they don't fully grasp the novel technologies themselves. In practice, a trust-based approach would refocus the consent process from simply providing legally required study information to promoting dialogue among researchers and prospective participants about the known and unknown risks associated with study participation. So with that bit of overview about how informed consent is, how it's important to partner with participants to overcome some of these ethical considerations around the design and deployment of digital health research technology, let's talk a little bit more about that idea of informed consent process as being a key component of cultivating trust among the prospective participants in a research study. I want to briefly jump back to the US Common Rule, the federal code, and emphasize these two components. The Common Rule outlines expectations for researchers to provide people with an opportunity to make an informed decision about their participation in research. The federal regulations emphasize that the consent process must facilitate comprehension and promote understanding of the reasons why one might or might not want to participate. The consent form templates that we know and love, created by our IRBs here at UT Austin, for example, offer a guide for researchers to develop the written consent documents that are compliant with the federal regulations. In practice, these templates, while they incorporate all of the required components, they become very lengthy and require very precise legal technical language that can be confusing for people to understand. So to the right of the screen is the very first page from a 20-page research consent form template for adult participants in research at the University of California, San Diego. It's very complex, difficult to read. Many people have recognized the need to improve the consent process. Previous research has explored how the choice of language, visual content, and interactive features may promote specific values in an informed consent process, such as understanding, reading time, and trust, specifically among vulnerable populations or at-risk populations. There are also specific recommendations for digital health research that involves online communities or ubiquitous computing research systems or novel technologies like artificial intelligence. However, efforts to improve the informed consent process beyond what is required must be created and facilitated by the research teams. To investigate the opportunities and barriers and potential unintended consequences associated with developing new ways of facilitating informed consent, our research team at UC San Diego, the Recode Health team, applied a mix of human-centered design methods to advance formative and empirical research. Part of our work refocuses attention from the written materials to thinking about informed consent as a formal process. While the regulations speak to what study information needs to be communicated during the informed consent process, does not outline the design and how it might be implemented. The consent journey may, if we think about the informed consent process as an entire user journey, that journey may involve many different touch points between a prospective participant, researchers, and IRB members, as well as others associated with the study. However, participants are primarily learning about a study by reviewing the written consent information. As a result, when people feel that they're not well informed about a study, they're less likely to participate. Even if they still, even if they have unanswered questions about a study, some people may still choose to participate, but possibly at a greater risk than they realize. So both of these outcomes, either dropping out of a study or choosing to continue a study without fully understanding what the study involves, without fully answering your questions, both outcomes can be detrimental to science. So for that reason, it's important to think about both what's written as well as the design of the process. From our research, there are clear opportunities to improve the informed consent process. As I mentioned, our team published a number of papers this last year. So today I'll just provide a brief overview of key findings and then discuss how the body of work demonstrates research practices that our community at UT Austin can continue to advance through research and practice. So people have expectations for a consent process. Our team underwent some formative research to recruit a focus group of people who are eligible to participate in a National Institute of Drug Abuse, NIDA, NSF, as well as the PCORI-funded effort that was part of the Healthy Baby Study. So the Healthy Baby Study was recruiting mothers and babies to participate in a longitudinal study where the babies would be wearing a sensor to track things like their breathing, their sleeping, their position of their body, and whatnot. Our team partnered with the Healthy Baby team to ask the question, what are human-centered and respectful approaches to informed consent from the perspective of prospective participants in digital health research? We were able to, working with the Healthy Baby team, recruit 19 people who were eligible to participate in the study to reflect on the Healthy Baby informed consent materials that had all been approved by the UC San Diego IRB. Our analysis of the series of focus groups identified 6 major themes that we discuss in depth in the paper. Academic professionals may use these themes in a variety of ways to promote understanding in an informed consent process. The themes might serve as scaffolding for an educational experience. Research sponsors, including the NIH and NSF, might apply the themes as criteria to evaluate how grant-funded research is incentivized and supported to demonstrate respect for people. Measures of readability are recommended tools to help researchers enhance their consent materials. However, our analysis in this paper points to another critical indicator that questions and answers raised during the consent process are really critical to pay attention to, beyond just the readability of the consent materials. So do the materials actually elicit what we refer to in the paper as informed questions about the study? Digital health researchers can help people to imagine what their experience of a study might actually look like and feel like by walking through scenarios and storyboards to really help people understand what their expectation of a study might actually look like. And to promote trust with people and communities, researchers need to demonstrate respect for a person's time and promote literacy when they want more details. This means helping people to make a decision about whether they want to participate in a study quickly so that we're not wasting their time. But if they want additional details, scaffolding that process so that we really promote literacy in the work. Finally, research should communicate with people in ways that reflect the values of the research team. The way that researchers communicate with participants speaks volumes about their level of respect for people and plays into how people evaluate their trust in the research team. So this was our formative work around what prospective participants are really interested in that informed consent process. And the six major themes were participants want to know about the technology, to know about the expectations for participation. They want more information about data, specifically how it's collected and how it's shared. And they want to confirm their understanding about the study. They also want access to multiple and interactive ways of reviewing the materials, and they need ways to keep in touch with the research team. So keep those in mind as I move on to the next two studies. The next one focused on the different levels of detail that participants want in their consent materials. In this study, our research question was, how do factors related to the content of consent material, its readability, its length, and lexical diversity, as well as the background characteristics associated with prospective participants, their sex, age, physical activity, and whether they track physical activity or not, how those factors might play into preferences for more and less information in an informed consent process. This question is important because of that heavy emphasis on readability as a way to improve the informed consent process. We wanted to know, is it just readability, or are there really other factors? And looking at it empirically, what other factors and to what extent sort of play into the more and less details that people want in that informed consent process? To explore this question, we conducted a survey-based experiment that involved rating 16 snippets of a consent communication, comparing an original version that was approved by the IRB with a modified version that we improved for readability using standard measures of readability. That's reducing the character length, a measure of reading ease, as well as lexical diversity. In this case, we partnered with the Your Move study team, which was funded by the NIH as well as NSF, to investigate the use of physical activity trackers to nudge people to be more active in their everyday. We were able to recruit 79 people who were eligible to participate in the Your Move study for our survey-based experiment. As part of the experiment, as we were presenting participants with each of the 16 pairs of the consent material, we also asked them for feedback about how we might improve the writing associated with the original version of the consent material, as well as the modified version. And we qualitatively analyzed that feedback to identify themes and what prospective participants were looking for. A majority preferred the original text to the modified version. So they preferred having more details than having a more readable version, which was interesting. Participants appreciated the shorter text of the modified version, but they found it lacked key details. Sections about study procedures, as well as the risks associated with the study, elicited a really strong desire for more details among participants. And the feedback, as we were analyzing it, we realized it generated more questions from participants, many of which were beyond the scope of the original consent materials. In this way, the asking people to engage with the consent materials really elicited informed questions about the study procedures and about the risks. Above all, the practice of partnering with prospective participants helped to identify the study information that participants need and want. Our qualitative analysis found that participants want readable information, but also specific details that correspond with their backgrounds and experiences, as we confirmed with our quantitative analysis. Our quantitative analysis of the survey involved logistic regressions, where we analyzed participant preferences in terms of the specific content section of the consent material, as well as their personal backgrounds. As I mentioned before, age, sex, as well as their level of physical activity, as well as whether they actively track their physical activity. these characteristics directly relate to components of the Your Move study. So what we found through our logistic regression analysis was that character count does matter. It directly corresponds with the observation that participants appreciate the readability of the modified version, though appreciate when additional details are included. So when the modified version was longer relative to the original versions, participants preferred that over the original version. But when the modified version was shorter, they were more likely to prefer the original version. Participants who identified as male were more likely to indicate that both versions were good, whereas participants who identified as female were more selective about some preferring the original version, others preferring the modified version. Differences by age group emerged as well. Participants aged 20 to 29 were more likely to prefer the modified version. However, participants 40 and above preferred the original version with more details. Participants who have a lower than average level of physical activity as rated in their pre-survey responses, as well as participants who rated that they have a higher than average level of physical activity, were more likely to prefer the original version than participants who rated their activity level as average. So this was interesting. I'll say it again. Participants who rated themselves as lower than average preferred the more detailed version of the consent information, and participants who were higher than average preferred it as well. But those people in the middle who rated themselves as average didn't have a significantly strong perspective on it. What this indicated was that those people on the extremes may have a stronger interest in the detail. However, it may be for different reasons, given their different levels of rated physical activity. We also found that participants who already tracked their physical activity were more likely to prefer the modified version. It's possible that they're familiar with the tracking devices, which is a Fitbit, and they've already worked the type of tracking procedures associated with the Your Move study into their daily workout routines. And we also found that participants identifying as Hispanic or Latino felt that both versions needed improvement. This is likely due to an oversight in the parent study, which only presented the information in English. So this was valuable feedback that we were able to provide to the Your Move study. What this collection of results really indicate, what I want to hit home, is that our research highlights how important it is to pay attention to the subgroups within your population of prospective participants, because they're thinking about different things in the consent process. Yeah.
Brian, I wonder if you look into how the education level affects their needs.
That is a great question. It's not one of the variables that we had in our survey. Yeah, we didn't have a measure of their education level in terms of grade. We could have included something like that. We also could have included something like their a scale score of their digital health literacy. We could have asked a question about, are you familiar with these different types of digital health techniques? Is there another indicator that you think we could have incorporated?
I think digital literacy, like health literacy, would be a good indicator. I mean, education level and literacy, of sometimes people use it like interchangeably. So the other question I have, maybe I can wait until the end, but I bring it up, is so you're asking for people's preference, but their preference might different when they behave, like when they read like a consent form in the real process, would they prefer the modified version or the original version, or it really doesn't matter?
Yeah, I mean, it's such a good point. It's what information are they paying attention to in the consent process, but we're not capturing things like, do they drop out of the study, We're not capturing things like, are they actually asking all of the questions that they have? What we found in our feedback was that in our qualitative analysis of the feedback about about how the consent material was written, was that people generated more questions than were actually included in the consent material. And what that means is that the consent material was missing questions. So by going through this process, we were able to identify questions that the research team can go back and answer for prospective participants before rolling it out to a larger population of prospective participants for the study. But I think you're absolutely right that it's still at that beginning stage of are they're making a choice about, are they going to volunteer or are they not? Now, I will say that is a critical point at which the research team and the participant begin to cultivate trust with each other. They begin to evaluate, do we want to move forward with this study? Do we actually trust what the researchers are going to be doing with the data? Do we trust what they're going to be doing in terms of the study procedures? Do we trust what they're saying based on how they communicate with each other, or how they communicate through the consent process? So for that reason, it's a really critical first stage, but certainly not the last stage to look at. As I described, it's a whole process that we can think about, going as far out to the return of results, as well as thinking about community building around research.
Yeah, thank you.
Sure. And while we're paused, are there any other questions? We're a small group, so Jan, I really appreciate your raising your hand.
I have some, but I'll wait to the end.
Okay, thanks, Stephen. Are there any points of clarification that I can provide? Okay, well, I'll tell you what, I'll keep going. This next study, each of these studies really build on themselves. Prospective participants value. The second, really diving into the text of the material and thinking about ways of improving and prioritizing different text-based information that we're presenting. Our third study dove into new ways of presenting that information. Data visualizations are very common when presenting complex technical documents. Data flow diagrams are used throughout system building, computer to communicate the architecture of a computing system. So they're fairly familiar for many people. We wanted to incorporate them into a consent process to evaluate how do prospective participants think about that information as they're evaluating their willingness to participate in the study. Yeah, sorry, I need to adjust my Zoom a little bit. There we go. So specifically, what factors in the design of a data flow diagram do prospective research participants value in an informed consent process? Data collection, processing, and sharing practices with third-party services can raise important questions, such as who has access to participant data, for how long, and for what purposes. These questions are important to convey during the informed consent process, as they help prospective participants to evaluate study risks and benefits. Information visualizations can communicate the nuance associated with data collection, processing, and sharing, and can be a valuable supplemental resource to the text-based consent materials. However, the process of translating content into a data visualization naturally involves making editorial choices about what information to include, exclude, highlight, and how. Choosing to highlight some content inherently means that other content is de-emphasized, if not removed from the diagram. So our focus group-based study partnered again with the Your Move study, as well as the commercial platform Talkspace, which is a digital therapy application, to present a cognitive walkthrough for a series of focus groups. We recruited 34 people and facilitated 8 focus groups online where participants used the online collaborative whiteboard platform FigJam to first look at the text-based material of the consent information and then explore a data flow diagram based on the information, and then consider alternate data flow diagram designs to emphasize different components of the information, specifically areas of risk. And then we asked participants to reflect on how the data flow diagram was actually generated. This research was supported by the National Institutes of Health and NSF. Now, when I say there's alternate ways of highlighting risk, we specifically designed those as points, as in the warning signs that you see on the data flow diagram in the center of the diagram. Pathways, such as those in the upper right, where a red arrow is coming in and you can see a loop around a series of other aspects of the data flow diagram, as well as regions where specific areas are color-coded to exhibit different levels of risk. We also played around with the level of risk associated with the level of risk presented to participants, providing fewer points, pathways, and regions to focus on, as well as much more complex diagrams for them to survey. Now, authorship is an interesting question about these data flow diagrams. Should the researchers conducting the study author them? Should they be authored by an IRB? Or perhaps a diverse panel of peers are brought together to evaluate a digital health system and create a data flow diagram that reflects what's happening within the system. We also explored the possibility that generative AI might be used to help author the data flow diagram. Now, what we found through our focus groups, the key advice from prospective participants was invite prospective participants to ask questions about the data flow diagram. They really wanted to facilitate that question asking process. So by asking questions like, what questions do you have about data collection, storage, or sharing? What do you think might concern other participants? They also emphasized that the warning signs, the different labels within the data flow diagrams, need to be clear, concise, and easy to interpret. And a data flow diagram can be a supplement, but not a replacement for the consent materials. So researchers have an ethical obligation to provide information about the technologies used in digital health research, including related risks, benefits, and risk mitigation strategies. While standard recommendations for consent communication is to include considerable details, this can yield a consent communication that is lengthy and dense. Visualizations and other media types offer opportunities for researchers to scaffold the information and levels of detail that people want and need in order to make an informed decision about their participation. Now, that question about authorship of the data flow diagram actually generated a mix of opinions among participants, though few felt that one solution was optimal. Many called attention to the different incentives among a research team, the workload that IRB members already need to manage, as well as the challenges coordinating a panel of peers. The preferred approach to generating a data flow diagram for a digital health study is to use a multi-staged approach where maybe an LLM is used initially to highlight key data processes, and then you poll the research team and a panel of peers to evaluate and enhance the LLM drafted materials, and then submit the data visuals back to the IRB for review along with other consent materials. So we learned a fair amount about how not only how to design the data flow diagrams that might be incorporated into the consent process, but also how to think about the authorship of those materials, which is an important consideration as generative AI becomes much more prevalent. That was not the preferred outcome. Instead, this multi-staged approach was what prospective participants felt would cultivate trust. And with that, I want to lead into really the last part of this talk, which is how to think about those new considerations for increasingly computer-mediated informed consent. To explore this research, we asked the question, what are opportunities, barriers, and unintended consequences associated with those key touch points in a futuristic informed consent process? So you might recall several slides earlier, I mentioned that there is that critical difference between the written consent materials as well as thinking about informed consent as a process. To explore this research question, we developed a design speed dating approach with prospective participants and service providers. These are researchers and IRB members. This involved considering 7 broad design ideas for the future of informed consent. We facilitated focus group discussion about their possible ethical, legal, and social implications. The focus groups were held separately for 21 prospective participants and then 20 total service providers. So in total, the study involved 41 participants and was funded by the National Institute on Drug Abuse, NIDA, as well as the National Institute on Aging. The design speed dating workshops were conducted to explore dimensions of the consent communication design space from the perspective of people on the front and back stages of informed consent processes. These are the prospective participants as well as IRB members and researchers. Over the course of a 90-minute speed dating sessions, participants were introduced to 7 future digital informed consent processes our team developed based on the formative study that I started this talk with. The future consent processes included social media, interactive quizzes, chatbots, annotation tools, and virtual learning sessions, really spanning as much of that gamut of design space as possible. While the technologies presented to participants through this study reflect existing forms of media, from a service design perspective, where we think about that movement of the people on the backstage, the researchers, IRB members, and how they're facilitating informed consent, we felt that the associated processes captured a range of possible human-computer interaction around critical touch points. The full list of ideas are off to the left, and you can see some of the low-fidelity sketches that we use to describe these ideas for participants. Low-fidelity depictions of the ideas were used. These are sketches, notional graphics, so as to focus participants on the concepts rather than specific decisions in high-fidelity prototype. Now, in total, 41 people participated in speed dating in design sessions, which include 21 prospective participants, as well as 20 researchers and IRB members. The speed dating sessions lasted approximately 90 minutes, and transcripts and polling data collected during the sessions were studied to identify touch points which our team synthesized through an analytic memo writing process into 5 principles to improve digital informed consent processes toward the future. These included being concise, which involves making sure a consent communication is clear and relevant, promoting transparency by helping people to feel comfortable asking researchers and IRBs questions, valuing time and effort by presenting people a level of detail in the consent materials that corresponds with the level and types of risk that they perceive in the study, opportunities to engage with researchers as a way of cultivating trust. And then prospective participants also had concerns about managing their data that could be collected through a futuristic consent process, which we describe as navigating some of the platform risks. For time purposes today, I'll only share some of the insights about cultivating trust and very briefly, sort of looking at the clock. We identified these 2 touch points of averting feelings of guilt and nervousness that come up as people are engaging with the consent materials, helping people to evaluate their time commitments, include information about how data is collected and used, and then choosing technologies that are broadly accessible can all help to avert these feelings of guilt and nervousness that come up around a consent process. Maintaining reviewability also helps to cultivate trust. This involves using key terms to help participants search for study materials. Many participants talked about doing keyword searches in their email platforms so that they could bubble up that information about a study that they participated in months ago. And then to the extent possible, return results back to participants. Several implications for design and practice came up through this research. We discussed 3 steps that researchers, IRB, and research sponsors like NSF can take to promote new informed consent processes for digital health research. These include integrating best practices from our analysis into online workflows for launching digital health studies on recruitment platforms like Research Match. Other implications for design and practice include developing protocols for moderating content generated during digital health consent processes and creating tools to help IRB members and community representatives to evaluate digital health study materials. At a higher level, we identified several key risks associated with the design of futuristic consent processes that are entirely computer mediated. If a prospective participant chooses to skip over or skim sections, have they reviewed enough of the materials to actually consent to participate? If parts of a digital consent process access a third-party platform, what instructions do prospective participants need to protect their privacy? If consent materials are updated, how might service providers manage version control? How might ethics review boards use data about consent processes to identify ways to promote dialogue with participants? We list and discuss all of these different risks and open questions in our paper. So with that, I want to move on to the absolute final couple of slides. How might we improve informed consent processes in digital health research? If we think about all 4 of these studies, they're about partnering with prospective participants, IRB members, and other stakeholders. It's also about taking a human-centered approach to explore opportunities to promote understanding through cognitive interviews, service design, human-centered data science, as well as social informatics, all skills that we teach students within the School of Information here at UT Austin in our health informatics program, social informatics, among others. We have terrific master's students and great doctoral students. And then finally, it's rather than thinking about readability alone, really striving to elicit those informed questions about the research. Eliciting questions was a really core thread diving through all 4 of the studies. So with that, I want to conclude, and I look forward to any questions that you have. I'll also drop a list of the articles into the chat so that you have them. But thank you so much for your time.
Cool. Thank you, Brian. If folks have, I have a question, but I don't want to jump in for others, but I also know that many people will have a hard stop. So maybe I'll just ask my question. I love this. Years ago, was on a panel when the common rule was being revised about 15 years ago.
Wow.
Think about the future of the common rule specifically for research on children, and other vulnerable populations. But so I'm super interested in this, and this is like a snarky critique of human subject research and the 20-page or whatever, consent document. That one of the biggest things that I felt like we were up against in the revisions of the common rule and how it gets interpreted is that those practices for IRBs are actually more designed to protect institutions than they are to protect human subjects. I mean, in other words, the reason it's a 20-page document is because the university wants to protect itself, university is not motivated to get good science. I'm sorry. The university lawyers are, concerned about protecting the university from liability, not about, the best methods for assuring human subjects protection. I mean, that can be secondary, but the primary concern of a document that's a 20-page legal document becomes protecting university liability. So I'm just, I believe in the, emphasis on partnering with participants to like better understand how they understand and consent to participate in research and are then represented in research. I mean, this is the critical thing about making sure that everybody, particularly people from underrepresented groups and from groups that have low access to literacy and those kinds of things, are represented in the science. And I'm concerned that so many of the practices become um, are kind of at odds with with exactly what you're talking about, which is like how do we best partner with if we can partner with our participants, but if our institutions are still protecting themselves regardless of what we learn. So I'm just interested if you've bumped up against that, and I know that that's probably another whole hour-long conversation, but what's your take on that dynamic and dilemma is?
Yeah, Stephen, I think about it in three ways. What are the opportunities to make advancements? And certainly, opportunities to make advancement happen at the local level with the local IRBs and thinking about the templates that we provide. Uh, can we develop can we develop interactive online systems that ease the process for researchers to implement best practices as templates? It also comes in locally in terms of the research teams. Can we encourage researchers to think about long-term engagements with stakeholder communities to really promote that trust over multiple studies, over multiple grant cycles, to really kind of create community? So part of it is at the local level, but another part of it is at the very highest level, thinking about the research sponsors that we work with, thinking about the NSF, NIH, PCORI, and private foundations, and encouraging them to think about the review criteria as well as the incentives that go into grant proposals to make sure that those ethical practices are really built into the process of review as well as the incentives provided to researchers. There's a really neat example of this that's being tried at Stanford University and led by Michael Bernstein. The program, I'm blanking on the acronym at the moment, but they have a nice paper that talks about incorporating a ethics and society review into the review of AI-oriented research, so that computer scientists meet with historians, communication scholars, anthropologists, and designers before their grant can actually be approved for funding. This is a nice, interesting model that personally I think should be advanced. So those are sort of two strategies, thinking at the local level as well as thinking at the highest level. I will say that a third level is thinking about the academic associations, thinking about what the Association for Computing Machinery, what Primer, what a number of the academic associations can do to promote best practices and community.
Thanks. So
Yeah, thanks for the question.
are you gonna be on the IRB?
At some point,
Yeah.
at some point, I'd enjoy the process after tenure.
Well,
The
probably
the my research, what's really amazing about our School of Information and UT Austin is that I have this amazing opportunity to sort of fuse my interests in public health with my longstanding interests in how do we promote civic discourse. So over this past year, I've been exploring more of the civic discourse side, sort of reconnecting with that. But in the future, plan on building in some more of the digital mental health, thinking about stress and anxiety around those discussions.
well, thank you all. I actually have to jump to another meeting, but I'm gonna make someone else the host so that if there is more, if people do have time to hang around, they can actually, maybe I'll make you the host, Brian, and that way, if people can I do that? Will it let me do that? It's not letting.
You could you could just make me host Steve if you want. It's okay.
Okay, okay, good.
Yeah,
Can
thank you.
stay on? And so I'm sorry, I have to wait. Now I think Jay has to make you host because I made Jay the host. Jay,
Yeah.
all right. Thanks, Brian. Good to see everybody.
Thank
Thanks,
you.
Stephen.
Are there any other questions from anybody? No, doesn't look like it. Okay. Well, thank you so much, guys. Thank you, Brian. We really, really appreciate it. It was a really interesting presentation. And we'll be posting this on our website and on our YouTube page today, this afternoon. I'll send an email around folks once the link is up for you to share with people. And yeah, thanks. Have a great end of the semester and take care, everyone.
Thanks so much,
Bye.
Brian.
Thank you.
Great, thanks.